Sponsored by the Dermatology Associates and Surgery Center.
And welcome back, audience. We are here in our studios today with Dr. Velazquez from Dermatology Associates and Surgery Center. How are you?
I'm doing very well, thank you.
Dr. Velazquez, I know that in your practice you see many different types of skin issues and problems. What are the most common ones that you see?
Well, in the field of dermatology, we see our patient population is from neonates, newborns, to adults and older. We see an array of different types of skin cancers that are sometimes associated with older individuals, and then we have rashes that sometimes we see at different times. We see children many times come with issues with dermatitis, meaning atopic dermatitis, seborrheic dermatitis. They have situations where we have issues with fungal infections, and many of those patients, when they come and see us, unfortunately have had these conditions for a long period of time. They're difficult cases because they either have different conditions associated with the problem that makes dealing with the situation more difficult, and that's why they sometimes go to other doctors and they're failing different treatments. So when they come to see us, sometimes we have to treat them with much stronger type of medications. Many of these medications that we treat, particularly for rashes, are usually things that goes with creams, emollients to try to help moisturize the skin. Then we have prescription type medications to include topical steroids, some other type of immunomodulator type of creams to try to help these patients get better and decrease the side effects of some of these medications. As patients get older, sometimes we start seeing things like psoriasis, and there's an array of different treatments that are developing to include different types of creams. There are medications to include pills and some injections that are now available for these type of conditions. Certainly we have issues with skin cancers, and we see many of those. In addition to that, we also see children and adolescents with acne type problems, and there's some thought that acne sometimes gets outgrown, and people usually outgrow that type of acne.
Right.
And that situation many times is erroneous, because we see patients with severe scars that if they were treated earlier, the scars will be minimized.
They could have prevented that had they come to see you earlier.
Absolutely.
Yeah, because you see sometimes hormonal changes, diets, sometimes bring on what they call, I think, adult cystic acne.
That's correct.
And you I'm sure, see patients with that, and that can potentially lead to scarring if they let that go, correct?
That's correct.
Okay.
So early treatment is essential to try to prevent these things from happening.
Right. So tell our viewers, if they have any of the conditions that we've just discussed, what would you recommend that they do, and where are you located?
Well, certainly they should seek medical advice through either their primary care physicians or dermatologists. As a dermatology group, we have different offices in the regions, and we try to see the majority, if not all, insurances. So we try to be all-inclusive as much as we can under the circumstances.
Great. Well, Dr. Velazquez, thank you so much for being with us. We'll be right back.